guys, Dr. Andy here. Today I would like to really briefly show you one awesome secret to dealing with a disc herniation, okay? So obviously a disc herniation can be quite severe in terms of the symptoms that it causes and can last a pretty long time. So anything that we can do at home to help deal with the symptoms while we're waiting for further treatment is fantastic and necessary, so maybe that you can get some relief and you can get a little bit of sleep, okay? So a disc herniation, the disc itself is like a shock absorber that sits in between every single vertebra. It's got a hard outer shell and a jelly inside, kind of like a jelly donut, like a jelly inside, right? So a disc herniation is when maybe there's like a little fissure or a little tear on the outside, the hard outer shell of the donut, and some of that jelly starts to kind of push out. Well, directly where it pushes out, a lot of the time is where one of your nerves are, your spinal nerves that come from your low back. If we're talking about a low back disc herniation, it's going to affect the sciatic nerve. And so the sciatic nerve starts in your low back, goes down your butt, down the back of your thigh, to your lower leg, to your foot. So if you have any kind of pain going from your low back all the way down your leg to your foot, it feels like a lightning bolt, it's electric, it's pretty severe. You could have sciatica due to a disc herniation, okay? There's not a lot you can do to make yourself feel very comfortable except for trying to centralize the pain. What I mean by that is trying to get the pain to come away from the leg and away from the side and a little bit get it going towards the center, okay? Movements that I want you to avoid in most cases with a disc herniation is anything with flexion, meaning leaning forward. Anytime that you're kind of bending forward and picking anything up, anything like that is typically going to cause the pain to flare, all right? In a lot of cases, extension actually helps, okay? So this is a yoga pose. I think it's called Cobra, but it's also just a general extension type exercise, and it can provide a lot of relief, okay? So to find out if this is a good thing for you or a good technique or a good little stretch that you can do at home, start off kind of gentle. What you're going to do is get down on the ground where it's nice and comfortable and lay just face down, maybe on your elbows just a little bit. You can put your hands together or far apart, it doesn't matter. Hang out here, for about 30 seconds. And if this feels comfortable for you, what you're going to do, and you're just going to completely relax right here, and what you're looking for is for some of the pain maybe to start to feel a little bit better, and then to come a little bit towards midline as opposed to shooting down the leg, all right? Hang out here for a good 30 seconds, and if this is comfortable, you put your hands underneath your shoulders on both sides, gently start to push up. All right. If you can lock out your elbows, that's perfectly fine. If you've got to find a different place a little bit lower, if it's not as comfortable for you, that's fine. Whether it's halfway up or all the way, that's fine. You're going to try and keep your hips in contact with the ground, and then you get to hang out here for 30 seconds or how long it just feels good for you. Just do that a couple of times a day or whenever you need to feel better. All right. So again, if you've got a disc herniation with sciatica, the pain down the leg, it can be severe. Sometimes it's really, really hard to get comfortable, and this extension type exercise is one of the few things that can help. Now, obviously, it can't always help everyone, so make sure that you're evaluated to make sure that this is something that can help you with, okay? But anyways, this is an extension type exercise for the low back for a disc herniation and sciatica. If you have any questions, send them my way. Always remember to live with passion, not pain.